5 things you need to know about doing in-office plastic surgery. 1. The options. What procedures lend themselves to being done in the office and not in the hospital? They need to be simple and relatively superficial so that we can numb them up. For example, the things that I do in my office include the brow lift, the eyelids, face lift, neck lift, lip augmentation, ear pinning, small liposuctions, small breast lifts, small tummy tucks, fillers. Number 2, when is it better to go to the hospital? The hospital is better if you have a patient who is not healthy. That is, let's say they have uncontrolled blood pressure or uncontrolled diabetes, or they have a disease like von Willebrand's where they bleed more. That also, if a procedure is long and complicated or multiple procedures, the hospital may be better. 3, the advantages of in-office procedures. First, they are quicker and less hassle and cheaper. Less hassle for the scheduling. They can be quickly put on the books. You don't have to match up with the operating time. And secondly, they are less expensive. If typically one goes to the hospital for a cosmetic procedure, because of the increased cost of the nurses in the operating room, the pre-op area, the post-op area, the overhead of the building and the equipment, and the anesthesiologist, the price is frequently double what it would be in the office. 4, the disadvantages of the office procedure. Those include long, extensive procedures that require maybe extraordinary equipment like a microscope, or multiple procedures that we're combining, so we're operating all day. These are probably better done at the hospital, especially if the patient has a medical issue. 5, choosing a surgeon. Let me first say that all the procedures that I've listed that can be done in the office, I can also do in the hospital. I have privileges in both, and I give the option to my patients as to which place they would like to go, and it doesn't matter to me, I can do either. But surgeons who are not qualified will not be able to go to the hospital, because the hospital checks the qualifications and the training and the board certification of all the doctors who operate in that facility. And if they find that he or she is not qualified, they will not give them privileges. So when you ask your doctor if he can do it in the hospital and he says no, then I would question his training and qualifications. These are 5 things that one needs to know before you do in-office plastic surgery.